Kenya government, through the Ministry of Health, expects to achieve its goal of universal health coverage by 2022, which means that every person, irrespective of where they live and their socio-economic status, will have access to good quality health services without having to go through any financial hardships. One of the key mandates of NHIF is to assist the government in the achievement of universal health coverage goals by mobilizing and registering members, correcting contributions, and paying out health insurance benefits based on the various packages that the fund has developed to the various segments of the society. And to effectively carry out its mandate, NHIF has designed a range of products meant to increase member registration and enhance service delivery. The diversification of products is expected to appeal to individuals and to meet members' specific health requirements. Today, we are entering into partnership with over 1,000 retired police officers to provide affordable and quality health insurance to them and their immediate families under their umbrella organization, the National Association for Retired Police Officers of Kenya. The health insurance needs of retired police officers are unique to their profession and circumstance, as we all know. During your active life, the officers may have been exposed to married life and health-threatening scenarios, which they could still be suffering from even in their retirement. A majority of the officers may also be locked out of the private insurance medical schemes due to your age and other circumstances. To meet the unique and specific needs of the officers, NHIF has come up with a special medical insurance package to cater for your medical needs. The retired officers will benefit from a range of services offered under the all-inclusive enhanced medical cover. The benefits include the following, among others. 1, outpatient cover benefit package for both curative, preventive services, which complies but not limited to consultation when you're going to see the doctor, laboratory investigations, drugs administration and dispensing, dental healthcare services, optical healthcare services, radiological examination, minor surgical procedures, rehabilitation, if needed, annual medical checkup, referral for specialized services, ambulance evacuation services, daycare services such as manual vacuum aspiration, surgery, and other medical services deemed fit by the clinician, tests for organ donors, and vaccinations. 2, comprehensive inpatient cover subject to one's limits in private wing and other facilities across the country. 3, overseas treatment. 4, emergency rescue services by road and emergency air services. And 5, specialized services such as hearing aids, diabetes, ICU services, HDU services, hypertension, cancer, medical care, and treatment thereon. And lastly, number 6, the last expense. NHIF has also partnered with hospitals across the entire width and breadth of our country, so the retired officers will have access to the health facilities of their choice whenever they will be. You appreciate that NHIF is a government agency that is out to help all Kenyans irrespective of what corner of this country you are in. I know some of us have earned charges in going to seek for the medical cover from the private insurance companies. And one of the things that I want to bring forth to you, NHIF is not going to look at how old you are to be able to give you the cover. When you go to these facilities, you will not be expected to be asked for any deposit when you are in this enhanced medical cover. And the facility that you go, it will be your facility of choice depending with your limits of cover. NHIF has a wide branch network. You can go to Mandera, you can go to Ramu, you can go to Nairobi. We have a branch network to support you in case of any issues.
Last expense is a benefit which is given to the family for purposes of funeral arrangement. Then group life is a package that is given to families for a soft landing, way or past disease of the member. Dental and optical is something you cannot get right now under your NHIF card, the card that you have in your hand, super cover. Now, provisions of the scheme and the instructions on how to provide the benefits to the members. This medical cover covers the principal member, spouse, and 5 declared children up to the age of 21. Beyond 21, we cover up to 25 years, but there is an exception. If a child is disabled, we don't have a caveat. We cover all the way. As long as you have a certificate from the Disabled Society of Kenya actually confirming that this child is mentally or physically disabled. And we also offer, the cover also offers up to 6 dependents, and the member 6 dependents being spouse and 5 children, but it is not limited. The members and the eligible dependents can access the services through outpatient, inpatient, and specialized medical services, where, like I earlier on mentioned, we have a network of 7,000 hospitals countrywide, which is inclusive of government, mission, and private health facilities countrywide. The outpatient members will visit, or the outpatient benefits can be acquired through very good hospitals, which are on our website. You can visit at any point in time. The inpatient treatment as well, also our hospitals are on the website. There is also what we call ndege for evacuation. So if you're at a place where maybe an ambulance cannot be able to access, we have Red Cross on board, which is able to provide air evacuation. Inform you that with NHIF, you can actually, what we are doing is we are rolling into the biometric age. And what you can currently use is the member's photocopy of the ID or NHIF card, which you can easily and quickly give to your dependents to access the services as we prepare to roll into the biometric system, where we should be able in future or very soon to give each and every member and dependent a card of his or her own. The inpatient cover can be acquired under these modalities. It includes medical and surgical conditions as administered or as instructed by the doctor, hospital accommodation charges, nursing care, diagnostic lab services, rehabilitation, operation theater services, specialist consultant, radiology services, surgical services, drug prescribed by treating clinicians, and pre-hospitalization procedures as mentioned. Patient cover, I believe most of you are currently attached to facilities where you can access benefits within a period of time, you and your families. You can access inpatient cover in our network of hospitals countrywide, which is 7,000 thereabout. We have maternity packages, renal dialysis in standalone facilities or facilities which have such services within themselves. We have kidney transplant, rehabilitation, package, drug, substance abuse, overseas treatment, oncology, which is chemotherapy, radiotherapy. We have also radiology, which is inclusive of zile picha, tunasema zile picha za mifupa na kadhalika, inclusive of MRI, CT scan, X-rays. We also have surgical packages all the way to a tune of 500,000 shillings. And that basically is what you can benefit from NHIF using the card you have at this particular moment and time.